So very broadly, I'm interested in governance issues, so trying to think about how do you, either in the case that I looked at, how do you engage the political system, how do you increase transparency and accountability in the system, and also how do you think about using different ways of measuring the impact. So how do you think about looking at, for instance, leakages along the way that may occur when you have resources flowing through not just politicians, but also through bureaucrats for these sectors?
Hi, my name's Rema Hanna. I'm an associate professor at Harvard. I've been working on randomized evaluations in India for about 10 years now, and in Indonesia for about 7, and I'm part of the team that's trying to set up the JPAL Southeast Asia office in Indonesia. I guess I have, most of my research interests revolve around thinking carefully through about how do you improve the quality of service provision for the poor. So within that area, there's basically 2 main areas. On one hand, I'm interested in governance and political economy issues. And so I've worked on questions such as how does corruption in terms of driving licenses affect the quality of drivers out there on the road, or in India, or looking at absenteeism in the health and education sector. Oftentimes, you'll see absentee rates of teachers at 60%. In the areas that we're working in, you see absentee rates of doctors at 40%. And it's trying to think through how do you even just get people in the offices to deliver deliver quality services. The other, and probably more connected to the conference today, is the other area that I'm interested in is the environment. It's one of the areas where the government and lots of nonprofits and organizations are really involved in trying to deliver clean water, clean air, and so forth. So, for example, I was involved in a 6-year evaluation looking at the impact of improved cooking stoves. In India, again, unfortunately, it's an example of an evaluation where, in the end, we didn't see huge health impacts, but where the evaluation was useful is understanding where the program broke down and understanding, as we start designing programs in the future, where can we move forward. And so I'll give it to Costas.
I'm Costas Meghir. I work at Yale University. I've got, I guess, a bunch of interests, but my main focus at the moment is on things to do with education and health and nutrition as far as developing countries are concerned. So we know one of the things that we want to investigate is the extent to which early health and early nutrition has an effect on child development, and I've already done some work on that in Colombia, and kind of have a continuing interest on that. The other aspect of this, and possibly actually linked to the health and nutrition issue, is the issue of child stimulation. There is kind of gathering evidence from all sorts of sources, be they medical, be they economic, that early stimulation is fundamentally important for the development of the child. And of course, one of the key linkages there is where there's a link between health and nutrition and stimulation, and whether they interact to produce better outcomes. Our kind of hypothesis is that we're looking at that if one is going to worry about the early childhood, one has to worry about mental stimulation as well as health and nutrition. And there is more and more evidence that without stimulation you don't get good child outcomes. So the kind of interaction between health and stimulation at a very early age is one of my current and active interests. We have a project in Colombo with colleagues such as Horacio Atanasio, Sally Grantham-McGregor, and others, and we're starting hopefully a new one once we overcome all the bureaucracy in India, in Orissa. Other kind of projects that relate to RCTs I've either worked on or aspired to work on are things to do with school quality and delivery of kind of high-performing education. Let's say at the primary level, I've been involved in an RCT in Senegal, where we effectively provide schools with targeted funds for projects that they want to carry out, and we've been measuring effects there. Some of the results are very interesting. We don't understand them all, but we have some interesting and relatively high effects. in some domains. So that's the kind of school quality side, which we think is also important. And actually, if you think of it as a chain of policy, it builds on to what you might do earlier. So a good early start, followed by healthy and healthy kids later in a good education environment, has to be one of the key ways by which we build up human capital over the life cycle. I've worked on microfinance in what you might not think of it immediately as developing country, but certainly very poor, Bosnia, and looking at the interaction between microfinance and household well-being. Again, really interesting results there. The typical thing, entrepreneurship increases, household income does not increase. More importantly of all, but I don't want to judge that in a welfare sense, but more importantly of all, microfinance caused a decrease in education of young adults as they were being pulled from school to work in the newly formed businesses. This is something certainly interesting to investigate. Of course, that could be efficient, right? Because you're providing a job opportunity. If schooling is considered as having marginal schooling is considered as having very low returns, then that's of course what's going on. So the results of microfinance in Bosnia are spot on with what you'd expect from economic models and from earlier research. I'm also interested in, as we go up the education, up the age distribution in youth training in urban settings. I've been involved in working in Colombia with Horacio Atanasio and Adriana Kugler on training programs, RCT training combined with work placement. And of course, one of the key research questions, because we find very, very strong results there in contrast to other places, one of the key questions is to unpackage what we did in Colombia to its components and see what really works, and to replicate some of the strong results we've had in there. And the final thing that kind of brings all that together and is a core interest of mine are the elements of scalability of policy and the elements of long-term effects. So when I get involved in these kind of things, particularly in the Colombia thing, we're particularly interested in whether this policy, if it works and if it delivers what it's supposed to deliver, is actually scalable and sustainable as a policy that can be rolled out. And following that, and many of the RCTs, of course, are quite short term. What we are really interested in is projects that will have a commitment to follow up these cohorts and find out what the real long-term effects are. So, for example, how does improvements in cognition translate, or improvements in health translate to actual standard of living changes later in the person's life? Now, these are, of course, the key question. There's no point in just improving the IQ by a few points if that doesn't translate to anything we really care about. There's no point in well, there's perhaps a lot of point in reducing health deficits, because it improves well-being. But you also want to learn whether it improves long-run standards of living, and whether this kind of ill health is at the source of low standard of living of some individuals. This, in a nutshell, some of my interests.
Hi again. I spent a lot of time preparing my slides for this morning, so I didn't spend any time preparing for this one, so I apologize. But what I'm interested in right now is how people learn about something. So for most of the stuff that we've talked about today, we need people, we are concerned about how they're going to adopt a behavior or adopt a new technology, or realize that they can, call on their local authority and get them to do stuff for them. So all that implies people knowing that there are some returns to an action, and knowing what these returns are and how big they are. So underlying all that, there is a question of how they learn that, how do they discover that. So I'm interested in understanding whether people learn from their own action, or they observing what happens when they themselves adopt the technology and experiment with it. Whether they can also learn from others, seeing their neighbors do something. Can they learn from others that are abstract people, not necessarily their neighbors, but other people in other areas that have experimented with these things and generated data that is shared with them? In other words, if I go to some households in India, in a slum and I tell them the results of my Morocco water paper from this morning, is that going to convince people that they should buy a private tap? That's a question I think it's interesting, because it's about whether people learn from seeing data from studies that do not necessarily immediately relate to them the same way a neighbor would. But if people do learn from these things, then I think it opens a whole host of opportunities to share information with people. If, on the other hand, they only learn from their own experience or the experience of people around them, it means that we need to do much more macro interventions, subsidizing experimentation at the local level. So understanding more generally how people learn, what's good for them, what's and how their action and the collection of action of them and their neighbors can make a difference is what I want to study forward. So if you're interested in doing that, we can do it together. Thanks.
So I'm Seema Jayachandran. I spoke to many of you this morning. I'm an associate professor at Northwestern University. So my own research has not been squarely in the area of WASH and urban services. It's mainly been in rural areas, but related to some issues that touch on these topics we're talking about here. So my research focus has been on health and on the environment and on labor markets. So partly I'm here to learn. I'm interested in hearing the counterpart egg timer presentations tomorrow and to hear what your organizations are doing. But I think a lot of what I've heard so far does touch on health and the environment. So one area I'm particularly interested in is what Alex was mentioning earlier about thinking about livelihoods and some of these sanitation and garbage collection and hygiene interventions. So thinking about that both from the impact on the sanitation and urban services, but also on people's livelihoods. Another theme that runs through a lot of my research is on gender. So a lot of the health work is on child and maternal health. So projects that have that focus are of interest to me. So and geographically, I mainly work in Uganda and in India, and sort of am particularly interested in projects in India. So I will leave it with that, and you guys have an extra 30-minute endowment of time because we were so quick.